Hey YouTube, Sonia, Snowy White 79 here. If I sound a little funny, it's because I've got my Levsin or hyoscine dissolving under my tongue. It helps with spasms and nausea. I don't think my surgery went bad. I think it went really well. My doctor says it went really well. The first day was horrible. I did fine getting in there. I never really got nervous. I was just excited. When I woke up, I was so nauseous and in so much pain. And for like 5 seconds, I had my anxiety, which is usually quite a long time. So the anesthesiologist did promise that I wouldn't wake up like I normally do. He was going to take care of that, and I think he did an excellent job. So they gave me everything they could while I was in the recovery room. Reglan, Zofran, and Levsin for the nausea. They gave me fentanyl for the pain because I can't do morphine, and Dilaudid's on very short supply right now. So they got me up to my room, and my mom and my hubby were there, and I got, I was off and on how you are when you're waking up. And then I got to where I was awake more because I was just so nauseous. Then I started dry heaving and retching. Of course, there was nothing in me to come up. Not even acid was coming up, which is a good thing because those staples and that incision line don't need to deal with the acid. But it hurt so bad. And so my nurse finally called the on-call doctor, and it was my doctor's partner. My doctor is Dr. Todd Eibes, E-I-B-E-S, out of Des Moines, Iowa. And his partner is Dr. LeMasters, and I've heard really good things about both of them. He's just the one, like when I went to the information meeting, and he was the one who spoke that day. He's the one I did, my consult with and stuff. So I stuck with him. He knows this stuff. He's really good at what he does. So he wasn't on call that night. Dr. LeMasters was. Sorry, I'm shaking. And she said to give me some Ativan because while that is mainly for anxiety, it will also help with the spasms and relax your muscles. So they gave me Ativan and another dose of Reglan, and then I went to sleep. 3 hours maybe, I don't remember, but it was a lot longer than the 10-15 minutes at a time I was getting. And so when I woke up, I've had no more retching. I am still pretty nauseous. So they sent me home the Levsin, they sent me home Zofran, they sent me home some Ativan if I get back to that point. They sent me home on Percocet for my pain, which is working a lot better for me than the fentanyl pump was. They took me off both of my blood pressure pills, hydrochlorothiazide, because it can help you lose water, which we absolutely don't need right now when we're trying to get in enough water. And they took me off of my metoprolol because my blood pressure has been 100 over 60, 90 over 58. I mean, it's been on the lower end. The pre-op nurse had to use 3 different machines before she finally heard it for sure. And we still think the only reason it rose up high enough at that point was because the automatic machine repumped my arm so many times that it put me in pain. And pain will raise your blood pressure. But we got a legitimate blood pressure to move ahead with surgery. And so day 2 went a lot better. On day 1, literally, I was walking. I didn't even get to my room, and they had me walking. They parked my bed right outside my door and told me I was going to get up and walk to the bed. And I looked at them like they were crazy, and they're like, we know, and it's going to hurt, but you're going to do it, and you can do it. So they helped me, and I did it. And then about 2 hours later, they came and got me up and said it's time to go for a walk. So we made it 3 doors down from my room before I was like, well, we got to turn around. Then the nausea hit extreme after that. So by the time all that had settled down, it was like 10 at night, I think. And I wanted to go for a walk because I know I need to walk to help prevent blood clots. I need to walk to help heal. I need to walk to help break up the gas, yada, yada, yada. So my nurse at the time was pretty busy. She went and mentioned it to the other nurses on the floor, and one of them got a break before she did. So they came and took me for a walk. And my floor, I kind of broke it up into blocks because there was one direct entrance that you could go all the way around. And then down at the nurses' station, there was an entrance that went across from side to side. And then at the very end, there was an entrance that went across from side to side. And then there was like a bonus room. It was just a waiting room, but you go in there and you have to circle back around. So my third walk, we went out my door and did the first small block. And I was done. So I went back in. And then later that night, I made the whole block. It was probably about 2 in the morning. I made the whole block. And so on day 2, I made the whole block. Oh, they took my catheter out on day 2. And since my catheter was out, I could walk with a family member. So I didn't have to wait for a nurse to go walk anytime I wanted to. So I walked quite a bit. I know I made just the solid block several times. And then I got up to where I was doing 2 laps. And last night was like the second time they'd given me the Percocets. And they're fairly, I don't know, they're good sized little pill. And they were slicing them in half so they'd go down easier. But that meant I had to drink more water. Well, and I wasn't aware of the time. I had woken up and wanted something to drink, sip on. And my chicken broth was still there, and it was really good chicken broth, even cold. So I was slurping on it, so I already had something in my stomach. So by the time I swallowed that 4th one, and you guys are right, when you know something's not going to go down, you know at the instant it's too late to stop it. So my 4th Percocet, it felt like it was stuck like right here. So I got up and got to walking, and on about the 3rd lap, it wasn't stuck anymore. So it's like, okay, I'm going to do one last lap for good measure. So I did 4 laps. And then this morning was really about keeping track of my vitals. I hadn't peed a lot over the night. Like, they took my catheter out yesterday morning and my levels were fine. But once nighttime hit, I had like 100 cc's or whatever it is the whole night. And I was drinking. But then I was also walking quite a bit too. So I guess, and I know I got sweaty a couple times. But, so they pulled some blood to check my kidney functions, and they were fine, thank goodness. And so, since they were fine, it was time for me to get to go home. So, I got to chat with the pharmacist about the Lovenox shots, and, experiment with that. And they have this little pad that you hold and pinch and poke. And they said, as long as I can remember the P's, I'm good. You pop the top off the needle, you pinch an inch, you poke yourself, you push the fluid in, you pause, and then you remove it and put it in your sharps container and you're good to go. They sent me home with alcohol swabs, they sent me home with a sharps container, they sent me home with a DVD and a manual in case I forget how to do it. I don't think I'll forget how to do it, but I mean, pretty medicated in the hospital. So I thought that was very good that they send you home with all that. I had some more broth, and they actually give us Isopures in the hospital. Yeah, those $4 a bottle drinks. So I've got like 3 of those that I brought home because I didn't finish hardly any of them. But I did finally find a flavor I think I can stomach. The orange banana pineapple. It's not so bad for an Isopure. I just hate how dry it leaves your mouth. So it's a 2.5 hour trip home. I had them wait and give me my dose of Percocet till like right before we were ready to leave. So I napped most of the way home. When we got back into town, we went by my work, which is a hospital that's affiliated with the hospital I was at. But it's where we get all of our prescriptions from if you're in our network. So, and I actually work in the pharmacy, so that helps. So we went in, so I got to see some of my coworkers and stuff, and that was nice. And they were all glad to see I was doing well. And so we got all of my medications. I got a bag full of Lovenox shots. I've got omeprazole. I told you about the Ativan and the Percocets and the Levocin. And I think that's about it. So, well, and then I'll still take my citalopram, and I'll still take my levocetirizine. And I need to go see my primary care in 3 to 5 days. So tomorrow I've got to call and make that appointment. And I see my surgeon a week from yesterday, at which point hopefully he'll get to remove the staples, because I feel really funny walking around with so many staples on my skin. They took my drain out today before I came home, so I just have to leave it packaged, covered, and change the bandage as needed. They sent me home with my lovely incentive spirometer. Can you read those numbers? I'm getting up between the 2,000 and the 2,500 mark. Before surgery, of course, I was hitting the 4,000 mark. But the first day of surgery, I was barely hitting the 500 mark. So, making good progress there. I also kept my little vomit bucket in case I feel like I'm going to vomit, and it's not like I can move real quick. So, besides the dry retching, thankfully I haven't vomited anymore. Everything's staying down. Yesterday I got in about 40 ounces of liquids total. 30 of that was water. Today I've had 36 ounces of water. I've had some chicken broth. I've had some unsweetened applesauce. And I had 2 bites of vanilla Greek yogurt. So my husband's gone out to buy me more protein shakes, ready to drink ones, because we ran out of those and I just don't feel up to shaking my nectars yet. That sounds bad. I'm not up to shaking my nectars yet. But yeah, I'm not up for that either. So he's going to bring me home some of those, and he's going to bring our little puppy home. So we miss him. He stayed with my brother-in-law. And Daddy doesn't want you in the videos, baby. Because you're too cute. But here, let's do this. You can talk to them without being seen.
Hey guys.
What do you think of Mommy's surgery?
Actually, it's kind of cool.
Yeah?
Yeah.
What do you think of all those staples in her belly?
Not really, but...
Is it kind of creepy looking?
Yeah.
Yeah. What are you looking forward to most out of Mama's surgery?
Because, well, I'm looking forward to me and her getting to have lots of times to play and run and go outside and walk around the block and get to color a lot together.
And Mommy will be more active.
Yeah.
All right. So that's my little squirt. We have a pretty major X factor in our life, so for now my husband prefers that we don't put her on video too often, but you heard her opinions. So find me on Facebook. I'm sure I'll be spending a lot of time on there over the next 5 weeks. It's Sonia Hales, Hales VSG, one stream right there. Last name's Thiessen, Thiessen. Or you can find me in the Sassy Sleepers, or the Back to Basics, or the Butterfly Vixens. Non-scale victories, I sometimes post in there. So, I know, post-surgery gain, I was up. Now granted, it was the end of the day, so I'll do it again in the morning, but when I got home today, I was up 6.6 pounds from fluids and gas and stuff. So I'm looking forward to that going away, but since I was prepared for it, it didn't throw me for a loop. I was just curious as to how bad it would be. So since we've gotten home, my mom made me a bed up on the couch, because I'm not going to try to get down into my bed and get back up until my stomach's not quite as sensitive. And I've taken 2 naps, and I've done 2 5-minute walks. So that's it for now, guys. I'm post-op. I'm on the loser's bench. Glad to be here. All of you that are waiting, just keep going. It's not going to be easy, but it's worth it. Because my husband at one point, he's like, "Are you sure you should have done this?" It's like, yeah, I'm sure I should have done this. But that was the first day when I looked so horrible. But yeah, oh look, I got Levocin powder on my lips. I'm positive I should have done this, because I'm going to be a healthier me once I'm all recovered. So, thanks guys. Thanks for your thoughts and your prayers and your well wishes, and let's do this. All right, bye.